Hey there! Today we're diving into an important topic that every woman should be aware of: cervical cancer and whether you might be at risk. So, let's get right into it. First and foremost, let's talk about the human papillomavirus, or HPV. It's the leading cause of cervical cancer, particularly high-risk strains like types 16 and 18. Most women will contract HPV at some point, but it doesn't always clear up on its own. In some cases, it leads to cancerous changes in the cells of the cervix over time. Now, regular screenings like Pap smears and HPV tests are crucial. They help detect abnormal cell changes before they develop into full-blown cancer. If you're skipping these screenings, you might miss early signs of cervical dysplasia, which are precancerous cells. Women with weakened immune systems, such as those with HIV/AIDS or on immunosuppressive medications, are also at a higher risk. Their bodies have a tougher time fighting off HPV infections. Having multiple sexual partners can increase your risk too. HPV is primarily transmitted through sexual contact, so more partners mean higher chances of exposure to high-risk strains. Starting sexual activity at a young age? That also ups the risk, as the cervix may still be immature and more vulnerable to infections. And let's not forget smoking. Chemicals in tobacco smoke can weaken your immune system, making it harder to fight off HPV infections and increasing the risk of cervical cancer. Long-term use of oral contraceptives has been linked to a slight increase in risk too, but this diminishes once you stop using them. Multiple pregnancies or high parity might also play a role. It could be due to hormonal changes or increased exposure to HPV during childbirth. Other sexually transmitted infections like chlamydia or herpes can also increase your risk. They may weaken your immune response, adding to the risk of developing cervical cancer. Poor nutrition is another factor. A diet lacking in essential nutrients, especially antioxidants like vitamins A, C, and E, can weaken your immune system, making it harder to clear HPV infections. In rare cases, genetic factors might make some women more susceptible to cervical cancer. These are typically inherited mutations that affect how your body responds to infections. And of course, there's the HPV vaccine. It's highly effective at preventing infection with the most dangerous strains of HPV. If you haven't received it, your risk of developing cervical cancer is higher. Age also plays a role. Cervical cancer is more common in women aged 35 and older. The risk increases with age, as precancerous changes caused by HPV can take years or even decades to develop into cancer. So, those are the main risk factors for cervical cancer. Remember, having one or more of these risk factors doesn't mean you'll definitely develop cervical cancer. Regular screenings, vaccination, and healthy lifestyle choices can significantly reduce your risk. Stay informed, stay healthy, and make those regular checkups a priority. Thanks for watching. Don't forget to like, subscribe, and share this video with someone who needs to hear it. See you next time.